Mhm. Okay. All right. Is everyone able to see my screen here? Okay.
Yes.
Yep. One. Thank you.
Yes.
Okay, great. Well, thank you all so much for joining us today. Like I said, taking the time out of your Friday to be here, we really appreciate it. My name is Maddie. I'm a career development program specialist here with ABN. I recognize a lot of people in the Zoom call today. So for those of you who I know, it is great to see you here. And for anyone who is new, it's great to meet you. Just to give a really brief overview about ABM before I hand things over to our speakers today, we are a nonprofit based in the greater Boston area that focuses on workforce development initiatives for skilled immigrants. So people with foreign college degrees or foreign professional experience who are looking to come to the US and rebuild their careers here. And the topic of today's session is going to be specifically careers in technical healthcare. So this would be like surgical technician, radiology technician, respiratory technicians. Those are going to be the three specific careers that we're talking about today. And we have representatives here today from Mass General Brigham, UMass Memorial Health, and Tufts Medicine, who are going to be talking a bit more in depth about these three careers. So a bit about today's session and how it's going to run. I'm going to give our representatives an opportunity to introduce themselves and the hospitals that they're coming from. And then they're going to talk a bit more in depth about those three careers that we have listed here. And there will be time for a Q&A at the end because I'm sure there will be quite a few questions. I will say if you have questions during the presentations, put them in the chat and we'll go through and review them when we get to the Q&A section at the end, just so that we can let people represent and we won't interrupt their presentation. So to start here, I'm going to pass things over to our representatives from Mass General Brigham to start off.
Hello, everyone. My name is Elena Kuyun, and I am the Senior Workforce Development Manager at the Mass General Brigham. Thank you so much for having us today. I would like to extend my sincerest gratitude to my colleagues from the talent acquisition team who came here to join me to share their expertise in technical roles within healthcare. So these are Jessica Andrada, talent acquisition team lead, patient care services. She will talk about surgical technologists. Then Kylie Reardon is a senior talent acquisition partner at Allied Health. She will talk about respiratory therapist. And Diana Borg, senior talent acquisition partner, Allied Health, will talk about radiological technologists. Okay, and I'm just going to give a very brief overview of our organization before we dive into these three healthcare positions. So I'm pretty sure that you've probably heard about us. We are the world-renowned integrated academic healthcare system. We are a collaboration of 17 member institutions, and you see them all on the screen. And our mission is to serve the community, enhance patient care, teaching, and research. We offer a full continuum of care across a system of academic medical centers, community and specialty hospitals, health insurance plan, physician networks, community health centers, home care, and long-term care services. Can you please advance to the next slide? Thank you. So we are committed to enhancing patient care. Patients is the they always come first. That's why we actually exist. We are dedicated to the delivery of highest possible quality care that is patient and family focused, accessible, and equitable. We are also one of the nation's leading biomedical research organization with annual funding of over $2 billion. And we are the top system for National Institutes of Health funding in the world. Also, we are dedicated to teaching the next generation of physicians. We are a premier educational institution and a principal teaching affiliate of Harvard Medical School. We have over 100 accredited physician residency and fellowship programs, and we graduate over 2,000 physicians annually from our training programs. We are committed to serving the community. We have 5 licensed and 15 affiliated community health centers. I represent the Mass General Brigham Workforce Development Team, and we have developed diverse community partnerships to support our local residents. And actually, our partnership with ABN is an example of one of them. Next slide, please. Okay, and this is just a general overview, a dashboard of what we do. We are the largest private employer in Massachusetts, employing over 88,000 employees, and we serve over 2.5 million patients every year. And you can see the breakdown of all the systems of our affiliates on the screen. And next slide, please. I would like to finish this quick summary with giving you a News and World Report rankings of our hospital. Our founding institutions, Massachusetts General Hospital and Brigham and Women's Hospital, are ranked top 1 in psychiatry and obstetrics and gynecology. And I'm sure you've heard about McLean Hospital and Spalding Rehabilitation Network. So that's it. And I'm just going to pass it over to my colleagues from this next institution.
Thank you so much, Elena. And next off, I'm going to pass it over to Jeff from Tufts to talk a little bit about his institution.
Great, thank you, Maddie. And it's nice to see all my colleagues from the other hospitals here too. And it's great to be on this call today. And I have a lot of love for what ABN is doing, and happy to talk a little bit more about Tufts Medicine and our institutions. So, I thought for a minute I would just talk a little bit about Tufts Medicine as a system, a little bit more about our mission, vision, and values, and then I'm going to talk just a brief overview of our hospitals and our system, and then I'm going to spend just a minute or two talking about our workforce development initiative, which is really pretty new. So, our mission is really around empowering people to live their best lives, but also reimagining healthcare. We're hoping to really try to create an equitable and frictionless healthcare experience. And all of that is going to stem from what our values are, which is around trying to work as one team, trying to make each other great. We try to practice respect as much as possible, so we try to put each other first and put our patients first. Inclusion, where we want to listen and learn from diverse thought. We bring heart and compassion to healthcare. We have the courage to challenge the status quo, and all of that is around really delivering excellence, where we are aiming to deliver exceptional results for everything that we do. Next slide. So Tufts Medicine has about 13,000 employees. As a system, we've only been around for about 4 years. So we're relatively new. And I'm just going to quickly touch on our four major institutions. But, we have doctors and community practices that reach pretty much from southern New Hampshire all the way down to Rhode Island. So, Lowell General Hospital is one of our hospitals, and Lowell General Hospital is both the main campus in Lowell as well as the Saints campus in Lowell. So we have about 428 beds between the two of them. And Lowell General, for any of you that live in that area, is looked at as a really the big little hospital. So it is a very large community hospital, but it's also provides excellent and really recognized care, especially around our nursing, which has been recognized as a magnet designated hospital 4 years in a row. So, or 4 awards in a row. Next. So in Melrose, we have Melrose Wakefield Hospital and Lawrence Memorial Hospital, which is a two-hospital group around the Melrose area. So it's a small community hospital, 232 licensed beds, provides excellent care. In particular, Melrose Wakefield provides a lot of community-based programs in that area too, which are well recognized around fighting hunger, fighting making increasing health equity. There's a number of programs they run around WIC and uh, around healthy children and healthy families too. Next. We have Care at Home. So Care at Home serves about 110 cities, pretty much all over Eastern Massachusetts. So this is our home care organization. So we provide skilled rehabilitation care. We provide skilled nursing in the home for people, but we also have a couple of sites too that we'll provide care at too. So, about 450 employees. So we have a pretty big reach all across the area there. And last but not least, next slide. We have Tufts Medical Center, which probably most of you are all familiar with as well. So Tufts Medical Center is right in downtown Boston, right on the border of Chinatown. It is a academic medical center, about 419 beds. It also has a relationship with Tufts University School of Medicine. We operate very closely with each other. We are recognized at Tufts Medical Center, particularly for our cardiac care and cancer care. And I can tell you that my mother actually received excellent cardiac care at Tufts Medical Center for more than a decade. I'm not only work for Tufts Medicine, but I also can say we're, patient family too. So next slide.
Who gives that?
So I just really want to quickly talk a little bit about the workforce development work that we do. So it is pretty new. I've only been with Tufts Medicine about 15 months. So we've only had a workforce development effort for 15 months. So our mission statement is really around committing to empowering our employees and communities through innovative workforce development strategies. And we are really looking to foster career growth and promote skills and experience, but also address the challenges that employees may have with advancing their careers. Because really, we're looking to try to create a skilled and welcoming workforce that delivers exceptional, equitable care across Massachusetts. So our mission for our workforce development work is really to invest in our people, strengthen our communities, and advance health and well-being for all. Our vision statement is where we are envisioning a future where every employee has an opportunity to achieve their full potential, to contribute to a vibrant, sustainable healthcare system that uplifts our communities. And we're doing that through transformative education, career pathways, strategic community partnerships like with ABN, and trying to expand access to healthcare careers, empower internal and external talent, and really drive workforce growth. Okay, next slide, please. So just a few quick snapshot about the different types of workforce development efforts that we've been able to grow in the past year and a half, well, almost a year and a half. So, we have a certificate program for our employees. We're looking at creating surgical tech apprenticeships, patient care technician training, which is like an acute care nursing assistant. We have EMT trainings for our employees. We have a pretty good tuition reimbursement program. We are offering now discounts relationships with colleges. And I have been trying to conduct monthly career information sessions, exactly like we're doing today, around just talking about healthcare careers. In terms of helping folks who aren't employed with us yet get positions within our hospitals, we're partnering with JVS to start critical care tech program and a farm tech program and central sterile supply program. We're looking at creating we already have externship programs for MAs, bringing LPNs in through apprenticeship, creating patient care technicians with Middlesex Community Colleges, as well as different relationships we have with community organizations. We're really also looking to try to expand opportunities for youth with co-op programs and summer youth employment programs. We provide tours, particularly at Lowell General Hospital, provides tours for all high schools around our area in Lowell. And then we're looking to create and expand more volunteer opportunities for youth too. So lots of work going on, lots of plans in place already. And then I think that's it. The next slide is just, yeah, going to UMass. So I will pass it over to UMass Memorial, and thanks again for having me.
Thank you so much, Jeff. And I'd like to introduce now, lastly, Amy from UMass Memorial. So go ahead, Amy.
Good afternoon, everybody. Thank you so much for being here. I'm Amy Averback. I'm a workforce development consultant at UMass Memorial Health. I've been with the organization for 10 years. I started in talent acquisition with them. And in the last 3 years, we've created our workforce development department. Our mission is very similar to those at Tufts and at Mass General Brigham. We're very large national, known for one of the largest national and most distinguished nonprofit academic health care centers. We are located in central Massachusetts, and in the Worcester area, we have our main hospital campus, which is and also shares the campus with the UMass Chan Medical School. Along with that, we have additional campuses in Worcester, and we have 4 other hospitals that we own, including Health Alliance Clinton Hospital in Leominster, Fitchburg, and Clinton. We own Harrington Hospital in Southbridge and Webster, Marlborough Hospital in Marlborough, and a newly acquired hospital, Milford Regional Hospital in Milford. We also have 3 affiliated hospitals, Haywood Hospital, Holyoke Hospital, and Day Kimball. We have a very large inpatient and outpatient behavioral health facility through Community Health Link. And along with all of our hospitals that we own and are affiliated with, we have over 100 physician offices, clinics, and emergency care services in central Massachusetts. We have specialty pharmacies located in that area as well. And through our affiliation with Chan Medical School, we do offer residency and fellowship to over 640 residents. We also work very deeply and in sync with the medical school for advancement and research with technology. and advanced practices. So again, our mission as well with everybody is that even though we're all separate entities, that we all have the same mission moving forward, and that is to improve the healthcare of diverse communities through culturally sensitive and excellence in clinical care, teaching, and in research. And we have over 20,000 caregivers within our system. And we all put forth UMass Memorial Health Cares values. And CARES, CARES, stands for consistency and excellence of patient-centered care, acting with personal integrity and accountability, respecting one another, affecting change through teamwork and system thinking, and again, supporting our diverse communities. Next slide, please. Just like the other hospitals that are here, we are all like a small city. We operate 24/7. We have positions throughout the organization, both in clinical and non-clinical areas. Here is a small depiction of some of the opportunities that we do have in the clinical areas. Workforce development is devoted to creating external pipeline programs through our community partners into the organization and supporting our caregivers in their upward mobility career paths. A lot of the positions that we have here, we have also created training programs through our workforce development, including bridge program from becoming a CNA to an inpatient patient care technician. We have an apprentice program for certified medical assistants. We recently had 2 large cohorts for surg techs to gain their certification. 20 people gain certification to become surgical technologists. However, now with the change in Massachusetts requiring an associate's degree, we are offering our Frontlines Scholars Program. So all of these positions that are represented are considered hot jobs for us. And any of our employees who are going to school and have a journey to become one of these technologist positions, we offer multiple supports to them through tuition assistance, paid learning time, flexibility in their schedules, laptop loaner program where needed, coaching and mentoring, study buddies, and more. Next slide, please. Maddie, you want to take over?
Yeah, all right. Thank you so much, Amy. And thank you to everyone else who's here representing their institutions today. Thank you for those overviews. I want to jump now into the specific careers that we're here to talk about today. So just as an overview again, for anyone who might have joined late, today we're going to be talking about surgical technician, radiology technician, and respiratory technician. So as we do these presentations, we're going to have each representative coming in and speaking a little bit about each role. So they'll be going back and forth to speak on these things. If you have questions while they're presenting, just put them in the chat and we will address them at the very end of today's session where we'll do an open Q&A with you guys. So just to jump in, we'll start here with surgical tech and I will pass it back over to you guys.
Okay. So what does a surgical technologist do? Surgical technologist is a key and a very important role in the operating room. Their main focus is to ensure that the room, instruments, and equipment remain sterile throughout the process and throughout the surgical procedure. So through training, the surgical technologists learn all about the various equipment and instruments that are needed. And each instrument, each surgery requires a specific instrument. So they do learn all of those instruments. They prepare a room before a surgery, and that is to ensure that all of the needles, instruments, and equipment are sterile. So they review and ensure that the sterile central processing department has sterilized all of the equipment. They get a tray ready for the surgeons and ensure that the equipment that is needed for that specific surgery is present. They help with counting before and after the surgeries to make sure that they have the appropriate number of instruments that they need, and afterwards to ensure that they start and end with the same number. They also help the scrub team, such as the surgeon and the nurses, with scrubbing, putting on their gowns, their masks, and their gloves. And then during the procedure, they hand the instruments to the surgeon. They may also help with at the sterile fields where the person's being operated on. They may also pass instruments directly to the surgeon or help hold a retractor or suction. They may help with sutures, and they are involved as being a trained person with extra hands during that procedure. They also are responsible for any specimens that need to be tested to ensure that they too stay sterile and that they are properly delivered to the laboratory for analysis. They also help potentially, to sometimes move the patients before and after the surgery, and also to assemble and disassemble any of the equipment and prepare it for sterile processing. Next slide. At UMass Memorial Health, all of our hospitals that I had mentioned previously have operating rooms. However, this is a little sampling of just our Worcester campuses, and I put this together just to show you all the different types of surgeries that can take place. So at our Hanneman campus, they do just outpatient surgery. So that's day surgery. And through day surgery, as you can see, they do eyes, plastic, general surgery, dental, hand, urology procedures. At our Memorial campus in Worcester, that is an acute care and urgent care hospital. And at that hospital, they take care of comprehensive cancer care, neonatal intensive care, women's services, labor and delivery, orthopedics, total joint replacements, general surgery, urology, and neurology. And our university campus is our Trauma One Center and also acute care center. And they are involved with a lot of transplants of organs. We do have our pediatrics there, our cardiology and cardiovascular is there, orthopedics, our neurosurgery, and also reconstructive. And a Trauma One Center is a hospital that takes care of very critical trauma-related patients. So at UMass Memorial Health, we have our life flight. So if there was an accident somewhere and patients needed urgent care, we would bring our life flight into that emergency situation, transport those patients to the Trauma One Center. Next slide, please. And I'll pass this over to
No, it's
Mass General.
Mass General, yep. So my name is Jessica Andrade, and I am a team lead for the Patient Care Services team, overseeing the Brigham and Women's campus as well as Brigham and Women's Faulkner, but here to represent all of MGB. So as far as the surgical tech program or education that's required to be hired into the role, there is some education component to it. So programs can be either 12 or 24 months, depending on if it's just a certificate degree program or a certificate program or an associate's degree program. And basically, with these programs, you would get a combination of classroom instruction along with hands-on and clinical experience. We have several schools in the nearby area that actually have their students come and do clinicals in our hospitals. So it's a way to kind of come in, get your experience, but also see the environment and where you could potentially be working past graduation. And then once you are done with the program, you are able to become certified. Some employers require that you become certified within 1 year of graduating. Others, however, require it upon hire. Within the Mass General Brigham world, some of us, it's kind of split even between us. So some of us are able to take you on without having that certification yet, but others would need that certification prior to you being able to start on campus with us. In the program, it covers a wide variety of things: anatomy and physiology, infection control, instrument identification, medical terminology, everything that you need to be ready to be a surgical tech at the end of the program. Next slide. And one thing I just want to mention actually, as far as programs in the area, there are several colleges nearby in the Boston area that do offer these programs. So we have Quincy College, Mass Bay, and then Bunker Hill. And I know that for the Faulkner, we have been partnering with Massachusetts Bay and Bunker Hill for doing their clinical rotations in our hospitals. Excuse me 1 second. I'm getting over a cold and I just have to cough, and I'm going to mute myself for 1 second. I'm so Thank you. I did not want to do that in everyone's ear, so I appreciate that. So at Mass General for surgical techs, we have 3 different levels of surgical techs. So anyone coming in that is new to the field will be coming in as a Surg Tech 1. And actually, Amy from UMass did a great job of explaining everything that a Surg Tech does. So that is what our surgical tech 1s would be doing. To move into a surgical tech 2, you would be working here for about 2 years. And with this, you'd be doing the same duties as a surgical tech 1, but you'd also be able, now that you're fully up and running, you'd be able to help to orient and support our new technologists that we are hiring into the departments, and actively participating in our different committees and initiatives. And then we also have a surgical tech 3. So this would be something that could be possible after 3 years of working here with us. And also with this, you're doing the same things as a surgical tech 1 and 2, but now you are kind of considered an expert across the different service lines. So you'd also be helping with any in-service works and really helping to put more input into the initiatives and the changes that are happening, as opposed to Surg Tech 1, where you're just kind of coming in and learning the ropes. Surgical Tech 3, we're really looking for you for your input on areas that we could possibly do better in, improve on any kind of changes that could possibly be needed to make us more successful and have greater patient outcomes. And for the different hospitals within Mass General Brigham, depending on what kind of hospital you're looking for, an academic medical center, a community hospital, that also impacts the amount of cases you'd be able to see and the amount of ORs. So some of our bigger hospitals like Mass General, they have 70 ORs. Brigham and Women's has 50. Then you get to some of the smaller ones. Faulkner has 16. And then we have our specialty, Mass Eye and Ear. They have 4 operating rooms. So again, it really just kind of depends on what you are looking for. And with surgical techs, there is, over the next 10 years, about a 5% growth, career growth projection for this field. Next slide. Thank you. And then for compensation, since Mass General Brigham has a wide variety of different size hospitals, academic centers, specialties, community hospitals. We have tried to be as much in line with compensation as we can. So basically what goes into figuring out the rates would be, like I mentioned, the location, if it's a community hospital, if it's an academic medical center, and then also looking at our internal equity, so our current surgical techs. So once we look at all of that, we would figure out a pay. I can say that for most of our surgical techs coming in, depending again on the facility, typical starting pay is somewhere between $28 to $31 an hour. But we do market adjustments quite frequently. We also do annual increases. And then also what goes into this is direct work experience. So anyone that has any surgical tech experience prior, that would also help to increase the pay rate. And we also look at indirect work experience. So that means that it's a role somewhat similar, but not an exact surgical tech. So if you had worked as a central sterile tech, a vet tech, a processing tech, cardiac cath lab tech, IR, a PCA, ORA, medical assistant, anything like that, we do look at that as well when figuring out compensation. So that is Mass General. I will pass it along to the next one.
All right. We will be talking about radiology technician next. But I do just want to say, Jeff, if you have your input, any input you want to put in there on surgical tech, I will let you jump in. I know we don't have your slides for you tops in there.
No, that's okay. And I mean, you all covered it so well as and I would just say that it's a hugely in demand position. You know, it's a great career, especially if you know, if you're looking to pursue an associate's degree, as these all are. And you know, you can certainly work your way into the department, particularly if you're thinking about like looking at careers like a central sterile processor, which I know we're not talking about, but that is a good way to kind of get your, I say foot in the door, but at least also just to understand how an operating room works. So usually central sterile processing doesn't need a whole lot of training in order to be able to become that. So that could be one pathway that you could look at, being exposed to surgical technology and learning how an OR works and learning what it's like to work in an operating room, which is very different. It's very busy and it's no windows. Oftentimes you don't get to see daylight, but it's very busy, very intense, and you can get to really work with some unbelievable people. So that's all I'll have to say.
Thank you, Jeff.
I just want to add what Jeff had stated as well. Another entry point for some people is to be a patient care technician in peri-op services. So you're working with the nursing staff. They're taking care of the patients before and after their surgeries. And by being in peri-op services and being in that environment, a lot of techs do become surgical techs. Thank you, Jeff.
Yeah.
Thank you, Amy.
Thank you.
All right. Our
So radiology, I'm up.
next up, we're going to be talking about radiology tech. So I'll pass this back over to Amy here.
Great. So radiology falls under diagnostic imaging, and the professionals in this area, without them being able to do this diagnostic imaging, doctors, surgeons, physicians would have a more difficult time being able to diagnose and treat a patient. It's really important for them to be able to look at inside what you see beyond the skin in a patient. And it's through this imaging, they're able to get a better idea of what the root cause may be and hopefully provide better, faster treatment for that specific ailment or issue condition. And radiology techs usually will escort a patient from the waiting room, bring them to their area to provide them with a gown to change into, and then bring them into the imaging room, making sure that while the patient's in their care, that the patient remains safe. They'll help the patient position them for the specific exam that they may be having or imaging that they'll be having. And through diagnostics, there are multiple modalities or different types of testing that take place. So a radiology tech is pretty much the main entry point for getting into diagnostics. Radiology techs are known for doing x-rays. And then once you have your certification as an x-ray tech, if you wanted to advance your career, you can then become certified in computed tomography, known as CT scans, MRIs. There's also mammography and interventional radiology. There's also 2 other modalities which you don't have to become a radiologist for, but you do go to diagnostic school for, and that is in ultrasound and nuclear medicine. Next slide.
I'll jump in quickly here. So my name is Diana Borg. I'm the talent acquisition partner for radiology, specifically at Mass General Hospital, which is part of the larger MGB system. But I do work closely with the recruiters across the system who support radiology. So just sort of to go off what Amy started with, the field of radiology to become a technologist, it is such a great career path. Most people do enter as a rad tech, but as Amy mentioned, there are different degree programs where you could also go into either sonography, ultrasound, or nuclear medicine, but those are separate educational paths that you would need to pursue. So we just wanted to share a little bit about how to pursue this field. So generally speaking, to become a rad tech, it would be a 2-year associate's degree. There are a lot of programs local to Boston and in really all of Massachusetts and New England. There are several programs out in Central Mass as well. But it's typically a 2-year degree, and there are some prerequisites that students would need to accomplish before they can apply to the program. I will say a lot of these programs are highly competitive and do have wait lists. So we have been finding that, it used to be that people who lived right in Boston might only go to Bunker Hill. But now we're seeing that people that live on the South Shore might actually be traveling further north to like North Shore Community College, because that's, maybe the school at the time that has an opening or where they're accepted. So these are pretty competitive programs just because it is a really in-demand field right now. But it's a great one if you can get into it. There's so much opportunity for growth. There are the advanced modalities, CT, MR, IR. IR is great if you're interested in like really procedural based care. But there's really a lot that you can do with the field. I won't go through all of the specific responsibilities because I know Amy started to capture that as well, but we can certainly go over questions at the end. There's just, again, there's so much that you can do with it. We do specifically at MGB, we do have a career ladder where you can, you'd come in as a radiologic technologist level 1. Depending on the setting that you're working in, you could advance up to a tier 3. Those are the technologists that are really doing the most advanced exams, also covering the emergency department, the OR, working with our inpatients. But being that we're such a large system too, we also have many outpatient facilities, urgent cares, and specialty hospitals. So radiology and what you're doing is a little bit different everywhere, depending on the type of setting and patient population that you're working with. So there is a lot of opportunity kind of depending on what you're looking to do with the career. Specifically on our main campus, where you'd be working with inpatients, emergency department, OR, things like that. Our starting pay for a rad tech is at 38, and then it really advances from there as you move through the career ladder and into the modalities. So there's a lot of upward mobility from that standpoint as well. And we do, similar to I think what Jessica said for the surge techs, it is based upon experience. So that's just sort of our entry new grad rate, but there is certainly room for growth. So next slide, I don't know if it goes back to Amy.
It does. So I just wanted to add that since we're in central Massachusetts, along with some of the colleges that Diana had mentioned, we also have a student affiliation agreements with Quinsigamond Community College, QCC, and Mass Bay, North Shore, Middlesex as well. So their schools do expand out into central and western Massachusetts. At UMass Memorial Health, we do have additional entry points for people who are going to school for diagnostics. And we have three main positions. First is a ASR, or associate service rep, and they are people who sit at the front desk. It's very customer service. They are working with the patients as they're coming into the office. They're handling registrations. They may be ensuring that other reports that physicians need are being brought to their appointment for them. And they are learning all about medical terminology, diagnostics, diagnosis, symptoms, and a lot of problem resolution. We have our patient care technicians as well, just like in Surge Tech. We have these in diagnostics and imaging, and they are working very closely with the nurses. And a lot of their duties are transporting patients, and because they have certifications, typically as a CNA, they know how to do vitals, patient care, blood work if that is needed in the office. And then we have our radiology tech aides who work more with the person doing the imaging and doing the scans. They may help lift the patient if they're laying on a bed. They also may help preparing the room before and after each imaging. They may also help to escort a patient to the imaging room. And sometimes they do help when there is a specific procedure that needs to take place. Next slide.
Thank you. I do see Jeff has his hand raised, so I'll let him comment here.
No, thank you. I just going back to being a rad tech, it made me think. So a number of years ago, well, actually, I shouldn't even say it, but a lot of folks who are thinking about healthcare careers oftentimes look at X-ray tech as sort of like a career where you're not dealing with a whole lot of blood and guts like you would with nursing or something like that. But I just want to say, because I think that there's this misconception that, you're just putting healthy people on a table and taking a picture of them. And the reality is not that at all. So, that means there are people who are coming in with all, you name it, but gunshot wounds and broken legs that are, all sorts of issues. So I just want to caution people that, careers in healthcare mean everything that you have to think about when you're talking about taking care of patients and healthcare. And so I think that there's that, like I said, I just want to make sure that there's not the misperception that if I want to go into healthcare, but I really don't want to deal with the gross stuff, maybe X-ray would be a great way for me to go, because after all, I'm just taking pictures. And the reality is that's not true. You have to be prepared for all kinds of situations. So I just wanted to say that, because I think back to times when I was counseling people on different careers in healthcare, and more than a few people had said that to me, and I said, no, hold on a minute. That's not necessarily true. But on the other hand, looking at a career that pays very, very well that has humongous potential for career opportunities, for growth, for being able to advance to different levels. Medical imaging is really an awesome way to go. So,
Yeah. Thank you, Jeff.
So I just included pictures of the different machinery and equipment that is used. This picture depicts what X-ray would look like, digital radiology, and it's very much like a camera, and it just takes a digital image. Majority of times it is used to identify and look at bones in all different areas within the body. Next slide. This is what a CT scan looks like, and it is a high resolution cross-sectional anatomical images that it takes, typically used to guide during biopsies, during surgical treatments, locating tumors, and can be used to diagnose different abnormalities in the brain, the nasal passages, the musculoskeletal system, spine, abdomen, lungs, etc. Next. This is what an MRI machine looks like, and it's a magnetic field that uses radio waves to diagnose diseases and injury of soft tissue. Next slide. And this is not the machine that's used, which is usually a hand wand, but this is what the image actually looks like during or after an ultrasound is used. And ultrasounds use sound waves to produce the images. And I believe that's a baby. So a lot of ultrasound is used in women's health, along with identifying other organ abnormalities, and again, is also used as a guide during biopsies. Next slide.
Okay. Before we move on to the final career we want to talk about today, respiratory technician, does anyone have any final comments or thoughts on radiology tech before we move on? No? Okay, great. Then I will again pass it back over to Amy here.
So what does a radiologist, respiratory therapist do? Sorry. So respiratory therapists are really a vital part of any medical team, and they work with patients from when they take their first breath to when they take their last breath and in between. So they do work with newborns all the way up through to the elderly. And their main role is to provide breathing support and treatment to patients who are having difficulty breathing or have blockage in their lung or airway. So unfortunately, a lot of people today with vaping and other smoking does affect their respiratory. And those are areas that the respiratory therapist sees when there's chronic respiratory disease that may cause asthma, bronchitis, or emphysema. They will also, during COVID and today, play a major part on the multidisciplinary team to help with heart attacks, if somebody has sleeping disorder. And they are brought in when somebody is in an emergency situation, if somebody is overnight in the hospital and needing treatment. So I think we have somebody from MGB in talent acquisition that might be able to talk more about this very important role.
Thank you, Amy. So my name's Kylie. I work as a recruiter with Mass General Brigham, primarily our two academic medical centers. And I work close to the respiratory therapy team for recruitment. So this is a fantastic, very in-demand growing field. As you can see, they're projected to grow 12% overall within the next 10 years. So a lot of opportunities for growth. In addition to what Amy mentioned, as a lot of the day-to-day, there's a lot of different areas in which respiratory therapists can work. So obviously in hospital settings, but they can also work in nursing homes, outpatient clinics like pulmonary rehab or pulmonary function testing, and even for medical device companies if they kind of want to get away from direct patient care roles. And then in terms of career ladder, we have a really wide range of roles that respiratory therapists can do throughout our hospital system. So obviously starting as a respiratory therapist, as most do, but then moving up to a senior. And then sometimes they will specialize in certain areas like the NICU, so working with our neonatals, and then ECMO, which is more like a critical care machine that they operate, ECMO, so they can specialize in that. And then, of course, there's all of our great leadership roles. So leads, supervisors, managers, directors, they can, really kind of grow from within the organization to any of those. Right now, our starting pay rate is $41.81 across our system. So again, that would be like a new graduate, and then as I think it was Diana that mentioned, we do also factor in experience. So if you do have experience, that may change the rate for that, just to give you an idea of kind of what typically you see in terms of rate there. Awesome. So I'll kind of end there unless anybody has any questions.
Thank you. I will just say, please make sure you're muted while our speakers are talking. And I'll pass it back to Amy.
So Kaylee went over the career growth opportunities. I think she covered all of these areas. The only thing that may be different is at UMass Memorial Health, we do have what we call a respiratory clinical technician 1, or also called an RRT technician, which is actually created for students. So while you're in school after your first year, you can apply for a limited license in the state of Massachusetts. And as a student, you can work in our respiratory department. Again, the duties are limited as a student, but it's a great way while you're in school. We do have per diem positions and part-time positions available that you can get your foot in the door right while you're still attending school. And then we do have a new grad program. So a lot of the RRT ones are accepted into our new grad program, and then they become a respiratory clinician too after their orientation as a new grad.
Okay. Before I pass everything on to questions, I just want to say, Jeff, if you have anything to add on the respiratory therapist, I want to pass it to you.
Only that respiratory therapy is probably one of the most unrecognizable and maybe unknown jobs that are out there. And I would encourage people to look into it. Respiratory therapists have a very interesting job. For instance, if you've ever had somebody in the hospital that is on a breathing machine, for instance, they are the only ones that can actually do anything with the breathing machine. Nurses can't, doctors can't, only respiratory therapists can. So with respiratory therapy, it is a very high touch, hands-on care with patients. Typically, respiratory therapists, as I understand it, will specialize in either children or adults. But it is an enormous growth field. It's great for people who have an interest in math, and particularly things like physics and a little bit of science, a little bit of chemistry that is in there. So you need all those things to be able to understand how air works and pressures work and things like that. So it is, so like I said, it's a very hands-on field. You get to know patients pretty well. You may see some of the patients over and over again over periods of time. And yeah, I mean, the earning potentials are humongous, particularly for a just an associate's degree. So yeah, that's all I would say about that.
Thank
So
you.
Jennifer is
And thank you also to everyone else that spoke about these roles just now. I am going to go ahead and I'm going to stop sharing my screen so that we can go into the Q&A portion. We have quite a bit of time for this. I have noticed, I think there were some questions coming in the chat during those presentations. So I'm going to start by just going through those and we can do that. And then we have additional.
we ready? Yeah.
All right. Let me go through the questions in the chat really quickly. Okay. UMass Memorial Health. This is, okay, is the surgical technician program, I'm assuming they would mean the training in person or online. This would depend on the school that you are going to for the program, but all three of these professions do require clinical hours, which are in person. So again, it would be a lot of in-person training, but some schools do have an online component for certain classes.
So at UMass Memorial Health, our surgical technologist program is hybrid. So you do go to school online, and then for the clinical piece and for lab and sim lab, that's all done on site at UMass Memorial Health. And then, of course, as you mentioned, all three of these professions, there's a clinical rotation, which you need to do at the hospital.
Yeah, so general answer would be it's a hybrid experience, in person and online. This person says, I'm interested in the radiology technician program, and I would like to learn more and begin the admissions process. I'm not sure if they're referring to the training or, yeah, go ahead, Jeff. I see your hand raised.
You know, and I think that that's a great question, and I would probably say the first thing that people really should do is literally get on the internet and just research each one of these positions. There are many, many videos out there of people who are talking about what is it like to be a surgical tech, what is it like to be a respiratory tech, X-ray tech, and they're all really well done, and it really gives you a sense of what the job is. And then, you know, you may feel like you connect with one particular job over another. And so the next step I would say to you is to go, you know, look at one or two community colleges that are near you, because again, all of these programs are available at most community colleges. I won't say all, but most. And sit down with somebody to review your, you know, to review your education. So, you know, if you have a formal education from another country, I would bring those documents in with you and have the folks review that, because they're used to seeing that. They're used to working with people from other countries, you know, and try to find out, or if you've actually taken courses here, but maybe you've never finished a degree, you get a transcript, find out like what courses are going to count and what courses aren't, because all of that information is going to help you understand how long a program you're going to need to be thinking about. Because, you know, before you even get in a program, there is the period of time that you're going to need to take prerequisites in order to get, you know, in order to get into a program. And if you have some of those that are already going to count, that's great. That's just fewer courses that you're going to have to take. Not only that is that being able to meet with folks at the community colleges and being able to meet with admissions people, they're going to tell you a little bit more about what's the process to apply, what is what is the classes like, how is it competitive, how can you do the best that you can do in order to be considered for a spot in the next class coming up, what does the timeline look like? But you can also ask questions about, how much time is it going to be? Like, how much studying am I going to have to do? And, you know, is this particular field going to be something that I'm going to need a lot of math or a little bit of math, or a lot of biology or a little bit, or a lot of chemistry or a little bit? So those are all important questions to ask so you can kind of figure out what is the career path that's going to connect with me and that I'm going to be able to do my best at. But also it's important to find out, all the education you may have had already, how does that count towards my future education? And so I would definitely spend a little time, if you come away saying, oh, those all sound interesting, I would spend a little time, doing a little more research and finding out which ones you really connect with, and then going to talk to some of the schools about what your pathway to education is going to be.
Yeah, exactly. Thank you so much, Jeff. And there, like he said, there are quite a few programs around the state. I actually see here that Kylie put a list specifically for respiratory therapy programs at the colleges here in Massachusetts, or around here. Actually, some of these are out of state too, but a lot of these colleges are going to also offer the surgical tech and the radiology tech programs. So I would look in the chat for a list if you're interested about the local programs. And let me see if we have, I think we have. Someone's asking about the documents they need to be enrolled in the programs. I know I can say right away, you will have to get your degree evaluated. So a lot of the colleges will need like WES or CED evaluation of your transcript or your degree. I can't speak on the exact documentation for other programs because everything's different, but if anyone else knows more information on that, please feel free to jump in.
Yeah, I would just follow up on, I would reach out to these schools because they may have different requirements. If you're interested in learning about their program, they can definitely walk you through those steps. But a high school diploma, I believe, is required for all community college or the equivalent degree, as well as they may have you take some courses as prereqs, biology, math, English, certain things, depending on the program, as well as they may look for certain testing. I think it's the T's or ACT or SAT if you're local. So like they may have you take certain like entrance exams, but again, it may vary school to school, state to state.
Yeah, and usually that kind of information is pretty accessible. Like if you go to, let's say you want to take a program at Quincy College, you go to Quincy College, look up surgical tech, and you can find all of the information of what's needed to enroll right on their website. And if you have more questions, you can always call the admissions office, which are typically pretty accessible. They will be able to answer any questions you have. So yeah, if you go onto the program pages online for these schools, they'll have that information. And another person asked about when they can expect to see the next cohort. I would assume you mean like when the trainings start. Again, this is also very dependent on which program you're enrolled in. So a lot of colleges, it depends on the college that you are working with. Again, that information will be on the program page, or you can talk to admissions about that. This question, someone's asking, does anyone offer on-the-job training which could later be used to pass the certification?
think typically that's part of these programs. If you enroll, I know like respiratory, you will actually get a clinical rotation. I believe that's similar for a lot of these programs where they will place you. And we do have students that do clinical rotations at a number of our hospitals. So you would definitely get some hands-on experience when you're enrolled in the programs.
Yes, the same would go for radiology. So you do need to complete the program and graduate a medical imaging program to be qualified for a rad tech position. But we do take students at MGB. I'm sure that Tufts and UMass are doing the same. Like all of these schools do provide clinical rotations. So you're getting your on-the-job training through your clinical rotation, which is a required piece of the program in order to graduate.
That's the same for the surgical techs as well. So.
Yeah, and I know for MGB, we do offer some tuition assistance. So if you wanted to start off in a role that was, I think a good one was like the equipment tech for the OR central sterile processing, something a little bit, less maybe requirements at the starting point, you could always look into that institution's tuition reimbursement if you wanted to then further, like as a surgical tech or something. I know we do offer some assistance with funds for that, which is really nice.
And depending on your situation, for most people, community college is now free in Massachusetts. So, there are some criteria you have to meet, but uh, by and large, a lot of people qualify for free community college. So that's also something that's amazing. So, you could be looking at pursuing degree programs at any of these or many more different types of degree programs for free and really have almost no debt when you come out of college and immediately start earning very, very good salaries. So that's also something when you're going to a community college, make sure you ask if you qualify for free community college. I'm sure they'll tell you, but it would be a good idea to ask too. But to Kylie's point too, if you're able to get employed with any of our hospitals or most around the area, there's always generous tuition reimbursement programs that we all offer. So.
Yeah, I will say about the free community college, and correct me if I'm wrong, but I do believe you can't already have a degree. So
That's
when
correct.
people
Yeah.
with foreign degrees, if they were to get that evaluated into a US equivalent, they would not be eligible for free community college.
Yeah, I was actually about to say that. Yeah,
Mm,
unfortunately, it's true.
yeah.
Yeah.
I didn't know how they treated foreign degrees, whether they still counted that as whether it still counted towards that or not, or if it was kind of a case by case basis. So it's good to hear you say that it's generally no go if that happens. So.
Yeah. And this is actually relevant to this topic. Someone's asking for the surgical tech program at MGB, what is the process for someone with a foreign medical degree?
So for MGB for surgical techs, it would be basically the same thing. You still have to go through the program because you would have to be able to get certified. Like I said, some of our affiliates, you are able to work for a year after graduating a program before you have to get certified. Other affiliates, you have to have that certification before you can even start with us. So you would still have to go through a program and get certified.
And many of these professions require a Massachusetts state certification.
Yep.
And is there an accelerated program for someone who already has a degree in the medical field? I know I can give some input on this. If you were to enter one of these programs at a college here in Massachusetts, if you were to get your degree evaluated, a lot of the courses you are able to kind of X off because you've already completed them. But there are certain limits to that. So for more of the general requirements, if you took them over 10 years ago, they're no longer applicable. And for science courses, generally, if you took them more than 5 years ago, they're also no longer applicable. So you can get your degree evaluated and transfer those credits over, but there are definitely certain limitations to time limitations specifically. This person asked about an X-ray technician, so about the radiology tech. What level do we need to become an X-ray technician? So this would be, it's the same. It's a 2-year program. The associate's degree would be for that. Correct me if I'm wrong.
Yep.
Yep, that's correct.
Okay, I think I've caught up with the questions in the chat. So if anyone wants to raise their hand and ask their questions, I want to open the floor to you guys. All right, I guess I'll answer this. I just saw a new one come in the chat, which is probably relevant, not directly related to the topic today, but definitely relevant for a lot of people here, because I know we have a lot of people with foreign medical degrees. But this person is asking what's the status of the physician pathway law, which, just to give a brief update on that, it passed last November. I'm sure you guys all know what this is, but for anyone that's not aware, this is a law that will now make it slightly more accessible for people with foreign medical degrees to get licensed here in Massachusetts. So it will allow people to bypass the 3rd level of the USMLE. So you only have to take the first 2. And then you can, instead of doing residency, work under a limited license. We're still working on it. Unfortunately, there is not a list of participating hospitals or health centers at the moment. So we're working on that. We're working on building the program that these health centers can use so that they can take people in and have them start working. So just to give a quick review of that. Oh, what if someone has a surgical technician certification from another state?
So for Mass General, we are looking for the national certification. So it wouldn't matter what state, you would just need that national one. I know for like the rad techs and respiratory, I believe those are the ones that are more the state specific, but for surgical techs, we'd be looking for the national. And I did see a question in there about if any of the people present today, if our hospitals offer these programs or if they have to go to a community college, you would need to do the educational college piece because we are not an education center in that respect. So we would not be able to provide you with the training and the credentials that you need to be able to take any of the certifications. So you would have to complete those programs and then apply to positions with the hospitals.
So Jessica, I have a question for you. Some states have still allow for a surgical tech certificate, and some have moved towards the associate's degree. So if somebody has their certificate in one state and they wanted to obtain a job as a surgical tech in this state, and they still had their license, their national certification, would that transfer over? And it's kind of blind to the education level as long as they have their national certification.
Yeah, because certain people were grandfathered in on when they took it. So it's usually those that have been a surgical tech for a long period of time, they would be okay. But yeah, as long as they have that national certification, then we would be able to move with them.
Okay, great.
Same thing as at UMass. We don't require an associate's degree for a surgical technologist. We just require that national certification.
Yep.
But if you are new and you are trying to become a surg tech in the state of Massachusetts, the state does require you to get your associate's degree.
Yep.
Does anyone else have any more questions? They can either put it in the chat or they can unmute and ask here today. Whatever you're more comfortable with. I know we're coming up on time anyway, so I guess I will, if no one else has any more questions, I'll stop us here. But before we go, I do have one quick thing I want to ask you guys. We have an evaluation form. This is a quick couple of follow-up questions. It'll include just some questions about today's session, just to see if anyone's interested in pursuing these kind of careers. So we have an idea of what the interest is like. So I'm going to go ahead and share this link in the chat so people can fill it out, because this would be really helpful to have your feedback from today. And while I'm pulling this up, I just want to say thank you so much to all of the representatives here today. Thank you all for making time for coming here. We really, really appreciate it. And thank you for taking the time. I do see, will we get a copy of the slides? I don't think I can share the slides directly, but I am uploading a recording of this on YouTube. So if you want to go back and re-review anything, it will be available to go back and look at.
Great. Thanks for hosting this. Hope it was helpful for people.
Yeah, I'm going to go ahead and put the
Thank you
link.
very much.
Thank you.
There is the link. So if anyone, so if people could fill this out before they go, or as soon as this is over, that would be very helpful.
Betty, is the link in the chat?
I'm putting it in there. It's for some
Oh,
reason,
okay.
it's not pasting. I'm working on it. Okay. There we go. It's there now. So I'll also send this in the follow-up email so you guys can have access to it. But I would appreciate if people could fill it out before they go. It won't take too long. Yeah, thank you all so much for coming today. And if you have additional questions, you'll be getting an email from me very soon. So if you have additional follow-up questions, just send me an email and I will do my best to answer them. If not, I can try to reach out to some of the people who spoke here today and get your questions answered. But yeah, thank you all so much for coming today.
Take care.
Bye-bye. Thank you.
Oh, Maddie, it looks like there's one person that has a question hand up.
Hi, Savanj, I see you. What's your question?
Hi, Maggie. I'm sorry, I can't see in chat a link which you sent.
Here, I'll send it again. It might have gotten lost with everyone saying goodbye. So
Yeah,
there it
thank
is.
you so much.
You're welcome.